We are Illinois CancerCare, specializing in cancer and blood disorders. We have 16 offices in 15 communities throughout central Illinois. With a cancer or blood disorder diagnosis, you likely have many questions and concerns. In the next few moments, we will help you to prepare for your first visit and hopefully answer some of the more commonly asked questions. But as always, please feel free to call if you have any others.
We hope that this video can answer some of the questions that you have and attempt to at least allay some of the fears that you certainly have racing through your mind.
On your first day, you will receive a lot of information, and you really do need time to sit back and digest everything that you're told. It really is a good idea for you to bring a family member or a friend with you, because there are so many things that you'll be told that it's always better to have more than 2 ears listening to everything that will be shared with you on your first visit here. Everything that you need should be in what we call our new patient binder. It's really helpful if you bring that binder with you. Within the binder, there are some forms that it's very helpful and saves time if you can have those forms filled out. We always advise people write down your questions so that you don't forget when you visit with the doctor to ask all of the questions that you have. Also, don't forget to bring a list of your prescriptions. It's very important that the staff and the doctor have that list of prescriptions that you currently are taking.
Illinois CancerCare or any cancer center is always a little bit of an overwhelming experience when you come to us with a newly diagnosed cancer, that everybody that comes in the door is wanting the best treatment that we know of, and that the experience that's available in this group is extraordinary, that we have physicians that are trained here in the Midwest as well as on both coasts and come from a great variety of academic experiences that further enhances the depth of quality that this practice exhibits.
It can be scary to come to a practice which is so large. We have a building that's 67,000 square feet. To walk into such a large place is overwhelming. So our architects, along with the help of our physicians, had divided our building into 4 pods. Each pod is self-contained. It's a place where there would only be 3 or 4 physicians working, and a patient would typically go there to see their doctor and have their chemotherapy. We've placed our laboratory and our radiology services in the center of the building, so when you walk in the door, you would just take a very short walk to the laboratory, and then from there, a very short walk to where you would see your doctor.
One of the benefits that this practice offers to our patients, and our patients only, is a retail pharmacy. Our pharmacists can help you manage all of your prescriptions. We have another staff person, Dr. Michelle Woods. Her title is PharmD. What that means is that she is a doctor of pharmacy, and she helps the physicians in evaluating all of the different drugs for treatments.
Our feeling is that the patients should be close to their doctors and their nurses. So when patients are receiving their chemotherapy, the doctor is literally just a handful of steps away if that nurse needs that doctor for any particular problem associated with their chemotherapy treatment.
I'm one of several mid-level providers who work as a team with your physician and nurses. We see patients throughout your cancer journey. I want to let you know that you're not alone in this journey. You not only have physicians, but mid-level providers, as well as a nursing team, a social work, a dietitian, who will all work together in helping you through this experience.
We have a large group of nurses at Illinois CancerCare. We're all highly trained in chemotherapy. We will explain everything to you so that you're going to understand what's going on before we do it. We just want you to feel like you could be our son, our mother, our best friend, and we would want them to have kind, compassionate care, and that's absolutely what we want to give you.
I'm one of 45 volunteers here. I have been for 5 years, and I have a daughter that right now that is under treatment for the 2nd time for cancer, and a lot of it is in my family, and I think this is one thing I can be here for you and all your worries.
And patients who come here are invited to bring their family with them for their physician visit and to bring their families with them for their chemotherapy visit.
on your first day to visit the Cancer Center here, you're confronted with many challenges, the kind of cancer you have, what the prognosis is, what the various treatment options are. The last thing we want to do is add a greater burden to that day, but it's really necessary on that first day to talk to an individual about whether they might be interested in a cancer clinical trial. Protocol therapy refers to a kind of experimental treatment which can vary as little as just changing the dose of a drug 20% all the way to having a brand new experimental drug that's not been used before. The reason we bring up this issue on the very first visit is that if an individual takes the standard treatment for their cancer, they would then not be eligible to enter an experimental trial. That's why we bring up treatment options the first day. It gives you a great deal to think about, but you can take the information home, you can review it, you can call us back. But if we don't mention this information on the first day, then one cannot put into context what the best treatment option might be for you.
I know, because I'm a clinical trial advocate, that 85% of children that are diagnosed with cancer partake of the clinical trial that's available for them. Their parents want the best for them. And it's very hard for me to understand why the grandparents of that child or the parents of that child would not want the best for themselves.
We've been involved in cancer research since 1978, starting with Steve Cullinan and Jim Gershner. We participated in some of the groundbreaking studies over that interval of time. Within the last 2 years, there are at least 15 new drugs that are available today or will be available and approved by the FDA in the next 6 months.
And I can understand in a way why people might think that they're guinea pigs. But the thing is, you are getting still the standard protocol. It's not that you're getting the clinical trial drug instead of the standard protocol. You're getting both.
The great majority of trials related to treatment do not involve a placebo arm. It's typically an ethically unsound thing to do.
Today, almost 80% of the patients who participate in any kind of clinical research in the United States are treated at their local community rather than at a university center or an NCI designated comprehensive cancer center. We also have, to complement that, a very extensive program of clinical trials where we bring new and novel compounds to the patients in our area.
I've seen people out in the street before that were previous patients, and maybe it's been 16 years or 20 years, and just the excitement to see them living their life to the fullest. And it's just, it tells me why I do come to this job every day. It's just, it's undescribable how I feel, and I know I'm doing the right thing.